Hey guys, it's Miss Woodruff here, and today we're going to do a full head-to-toe assessment. So this is a part of my basic skills video. These are geared to help any student, but keep in mind, every instructor might have different preferences for what they like or expect. I'm going to kind of just show you a very basic. So in your adult med surg class, you have a 50-point assessment assignment. I'm going to have a different video that has the more in-depth assessment, but this assessment, and let me grab my stethoscope before I forget. I need my cell phone / pen light. Sorry, Ms. B, letting you down using my phone again because I forgot my pen light, but forgive me. Anyway, this is a basic assessment. So this is what I want you to think about, like on a day-to-day basis. You work on a med surg unit, you're just going and do a basic assessment. What does that include? What do I need to do? Now, I'll tell you, in real life, you may not see as many nurses doing this, and you may say, hey, I never saw a nurse do any half of what you're doing. That's their personal choice, and I really hope with time that you also do not get into that same pattern where you're not doing that, but every patient needs to be assessed at least once a shift, no matter what kind of unit you're working on, and they should have something like this. Real basics, at least knowing the basics of how to assess every body system, at least on some level. This may need to be changed depending, and adding focused assessments like watching one of the other videos might help you, depending on what the patient is there in the hospital for. So to get started in a full head-to-toe assessment, obviously I'm going to come in the room, I'm going to wash my hands, I'm going to put some gloves on. I see some nurses do assessments without gloves, but I'll tell you from bad experience with having random bad things happening, like getting vomited on or patient randomly bleeding, things like that, I highly recommend wearing gloves for everything. Maybe a patient seems pretty clean, but especially with everything that's happened in this post-pandemic or middle of pandemic world, wherever we're at, we really want to always consider cleanliness and trying to stop the spread of bacteria. So put your gloves on, introduce yourself to the patient. Hi, my name is Kat. I'm going to be your nurse today. I'm going to do a quick head-to-toe assessment. I always like to start with making sure a couple things. First, in all of my videos, except for this one, I have forgotten to raise the bed. So I always want to start by getting the patient at a level where I'm not going to be crouched over like this. And I found myself in other videos, I'm like, wait, what am I doing? Why is this hurt? So it shouldn't be that way. But you always want to have the patient up, and I can actually probably stand to put them up a little bit more too. You want them kind of up at hip level where I can easily bend over. You always want to make sure to put the bed down before you leave though, so that the patient does not have a fall. So I have the patient at my level. I've introduced myself, let them know what I was going to do. And I want to make sure to provide for privacy. So, I could take, I'm not going to, but I would take my curtain. You always, and you may be like, hey, I closed the door, and that's pretty good, but people will just come rushing in. And if you have the patient exposed, that could lead to an embarrassing situation. So if you have a curtain, you can close the curtain. Try to provide for as much privacy as you can. It may seem like a little thing, but so key. So now, I've explained everything. I'm going to provide for privacy, and the patient is ready for me to do my assessment. The first thing I always want to ask about is, hey, do you have any pain? What do you call it? You always want to start with that. Here, I'll start with this. Can you tell me your name and date of birth? So I'm going to identify the patient. I want to see if they have any allergies or anything. And you may think, well, how is that going to affect what you're doing? But, if there's any tape or anything on them, it's maybe going to tell me something about them. A lot of people are allergic to tape. So ask about name, date of birth, and allergies. Then I'm going to ask them if they have any pain. And I'm going to ask them, hey, do you have pain anywhere right now? And if they do, I want to ask them on a scale of 0 to 10. I've had patients that I say, hey, do you have any pain? And they say no. And I say, okay, on a scale of 0 to 10, is it a 0? And they say, no, it's a 4, because they're so used to pain. To them, no pain is a 4. Just keep in mind, it could be different. So always ask them, even if they say like, oh, no, I'm not having any pain. I'm like, just check, is it a 0? And if they are having any pain, you want them to describe it and tell you about it. So I've introduced myself, I've figured out who the patient is, I've checked out their allergies, and I have, started my assessment to make sure that they don't have any pain before I get started. Now I'm going to move into starting some of the basic questions that I want to ask the patient. So I always like to start, I've already asked them their name and date of birth. I can ask them the rest of the orientation questions. Remember, we want to ask name, date of birth. We also want to ask them, okay, well, do you have, do you know where you are? And if they could tell me, like I told you in the the neuro assessment video, if they know where they are, it's great that they know that they're in the hospital, but which hospital? Do they actually know their location? And you want to ask them their situation, what brought them to the hospital this time, what are they doing here? And you also want to ask them the time. And again, I usually only expect them to remember the month because I barely know what day it is. So you get your orientation questions done. Then I'm going to do I always like to start at my head and work my way down so that I can get everything done and not forget anything. So I've asked about orientation. I've made sure they're in a comfortable position. I've provided for privacy. So I'm going to get started, and I like to start with my eyes. And so I would get out my pen light and I check for PERLA. If you want to learn more about PERLA, again, you can follow the other videos that talk more about focused assessments. So I'm going to go in with I'm going to put his glasses up at the top of his head, and then I'm going to get my flashlight out, and I'm going to, again, remember lights would be turned down. I'm going to shine a light in one side. I'm looking for the pupil, the round part of their eye, to go from a bigger size to a smaller size. I'm also recording what size their pupil is just at rest with the lights turned off, where I can see how large it is just at rest. So I've checked for that. Most patients, I don't need to look in their ears and their nose unless they're there for that problem. I always look at the mouth, and I like to look in. I'll get my flashlight again, and I'll say, okay, do they have any teeth? Because that's going to tell me a lot about their nutrition. How are they eating? What do you call it? And are they going to be able to eat? Do they need to be on a special diet? I'll probably also ask them, hey, are you swallowing okay? How's your appetite? Things like that while I'm here. While I'm also here, I think about the throat. Are you having a cough? Are you coughing up anything? What does it look like? So I'll start with a lot of that. And that's pretty much what I do for my head. I look in my eyes, check my pupils. I'm going to look in their mouth and see if they have any issues with either coughing, sputum coming up. I want to see if they have teeth in general. It's always good to see kind of what their general hygiene is. So that's my head. So then I'm going to move down to my chest. At the chest, we always start with inspection. So again, I want to only keep down as much of the gown as I have to. Usually I don't like to have the patient completely uncovered. So normally I would have the patient, fully covered up here so that I can keep them warm and protect as much of their modesty as I can. So I'm going to look at their chest now when I'm inspecting, looking for any problems, looking for any devices, looking for any skin breakdown, any problems, or any changes and stuff like that. So after I inspect, then I usually like to start with lungs. So I'm going to get my stethoscope. And like I showed in the respiratory video, when it comes to lungs, I always like to listen and see what they can do on their own without me telling them to take a deep breath. If I can't hear anything, I will ask them to take a deep breath, but it's a lot for a patient to take, I guess if we do say like 12 deep breaths right back to back. And it's also great to see like how well their lungs functioning. Are they actually taking deep breaths, or am I going to have to ask them to take a deep breath in order to hear anything? I usually just tell them, hey, you can breathe normally. So to do that, I would put my stethoscope in. I always start in my right up, and I know I'm on my left on this, so I say right upper, and I usually start farther away. And I listen, and remember, I'm listening long enough until I can hear, and I should be hearing just air moving. If I hear something wet, it may be a sign of an infection. If I'm hearing something that sounds like air whistling, it could be a sign that they have COPD or asthma. So I listen on one side, and then I go to the other. And I know I stayed on that side for a long time, but you don't have to stay. It's usually a few seconds. Then I'm going to go down a little bit closer to the nipple. Listen kind of in their middle lobe. Then I'm going to listen to the bottom part of their lobe. And then I'm going to do lateral. So remember, lateral is kind of in this armpit area. We call it mid-axillary. I'm listening on that side. And then I'm coming to the other side to listen as well. And remember, always go side to side to listen for those differences. While I'm here, I'm also going to listen to heart sounds. So remember, with heart sounds, we also start on the right side. We're on the right side of the sternal border, and I'm going to listen, and I'm listening for that lub-dub, lub-dub, listening to see if there's any murmurs, if I hear any whooshing, if I hear any extra sounds. I'm going to go over to the other side. So start here. Now I'm going here, and then I'm going down here. And then I'm making kind of that C cup around the breast, listening for that lub-dub until I get to the apex. If needed, if the patient has an abnormal heart rhythm, if they're on a special medication, I may listen for 60 seconds and count their heart rate. But otherwise, I'm all done auscultating their chest. And so I can cover them back up and make sure to provide for their privacy. Um, for me personally, I like to then move on to the arms. So I'm going to then start my peripheral neurovascular assessment. I'm looking at their skin. I'm looking for any devices. Any devices they have, I'm going to take off, look underneath. If they have any IVs, I'm going to assess those IVs for patency. I'm going to look for any problems, ask them if they're having a problem with that IV. Then I'm going to be feeling down on their arms, see what their temperature is. I'm going to be looking at the color of their skin, seeing if there's any abnormalities there. Then I'm going to be feeling on their pulses. And remember, I like to do these bilaterally. Use your 2 fingers, not your thumb. And I'm going to be feeling them at the same time to see if they're equal. So I'm feeling those for a few seconds. And then I might also ask, hey, are you having any numbness or tingling in your hands or in your feet? Ask them about that. So then I'm going to do my capillary refill, which is where I squeeze those fingers. See if there's any abnormalities. Remember, you just squeeze, let go, and you can do on the nail side or on the finger side. And so I've assessed skin, I've assessed peripheral neurovascular. I'm also going to have them do muscle strength. That's where I have them push on my hands, pull back against, squeeze my hands as hard as they can. Maybe do a little bit of range of motion, shrug your shoulders, move your arms around, wiggle your fingers. So then I'm going to move down to the abdomen. Excuse me, sir. I'm going to pull down your gown. And remember, when I do the abdomen, I like to keep the covers over their private area or their genital area and just expose what I need to expose. Remember, with abdominal assessment, we always want to start by inspecting first. And we want to look, might want to ask about, any different pain. As you're doing your assessment, pain can change. Hey, are you having any pain here? Okay. So because a lot of people can have abdominal pain and maybe they don't have it until you're really there messing with it. So you always want to ask. So I'm looking for contour. I'm looking for any changes. I might ask them, hey, when was your last bowel movement? I've already asked them about their appetite earlier, but I may ask them if they're having any nausea or other GI symptoms, any reflux. And kind of what their diet's been like recently, if they're on a special diet or anything at home. I'm looking for any pulsations. I'm looking for any masses. I'm looking for any abnormal contour, changes in color, things like that. The next step is I'm going to auscultate, and I'm going to start in my right lower quadrant. If you've noticed, at least for me, and I'm right-handed, you might, depending on what side of the bed you're on, I'm starting over here on the right side. I'm in the right lower quadrant. I'm listening. And remember, with bowel sounds, I should hear like a gurgling or like an air rushing, kind of where that gas is coming, or you might hear like a tinkling. So I'm going to listen. And remember, with bowel sounds, you do not need to listen for 5 minutes in every quadrant. You just need to listen for, I would say, 10 to 15 seconds until you can get a good sense of how active they are. If they're very active, you don't have to listen for that long. If they're not very active, you may have to listen for longer. So I'm going to listen in all my 4 quadrants here. Then I'm going to do a light palpation. And remember, light palpation, we're not nurse practitioners here. We're just trying to do a basic. I'm not trying to feel all their organs. I'm just trying to see if they have any tenderness or any obvious masses or problems. So I'm going to start in the right lower again and do just a gentle push, gentle push, gentle push, gentle push. And just ask them, and then usually I ask before, like, hey, let me know if you have any tenderness with this, and if I'm looking for them to respond or grimace or anything as I'm doing it. So usually I'm pushing and I'm looking at them while I'm doing it and see if there's any changes in their face. Because sometimes people are trying to be tough and try to say something's not hurting, and it is. Obviously, I'm also looking for any drains or tubes, and like I brought up in other assessments, anytime there's drains or tubes, let's say they had oxygen, let's say they had a chest tube, IV line, some sort of feeding tube, I'm always going to start at the tube and move out to the device and make sure that everything's turned on, working properly, and there's no sign of a problem. Your instructor may want you to do bladder palpation. Typically, that's not a normal part of the assessment, but when you look at the patient, you should not be able to see their bladder, because if you can, that's usually a problem. The next part of my assessment is just to assess their urinary system. Hey, how often have you been urinating? Have you had any problems with that? What does your urine look like? I'm going to ask them the same questions about stool. Don't be surprised if your patient doesn't know, because a lot of people don't sit around and think all the time, hey, this is what my stool, let me look in my toilet after I go to the bathroom. We do as nurses, but most other people do not. So always be looking for, always be asking about, what they see in their stool and their urine, what changes they might be seeing. Is there any odor to their urine? Do they have any trouble? If it's a male patient, you may want to ask them if they're having any issues with starting their stream. Do they have to start and stop? Do they have any flow issues? With females, you might want to look for signs of infections, any burning, you having to go a lot, because that's the next step. Once you ask about symptoms, you also want to ask about how is their intake and output? Are they drinking enough? Or how often are Are they going to the bathroom? Are they having any problems there? And what are those, issues they might be having around that? I know on your graded assessment, it says that you don't have to assess the reproductive system, but just know in real life, I can't just say, hey, there's no catheter down there. I don't need to assess it. We always need to look and just make sure there's no obvious problems. We don't have to do a deep stare or get down there with a flashlight, but you should be able to look and make sure that there's no sores or other issues. Like I said, a lot of people can have sexually transmitted diseases and other things. So do a quick visual, make sure that there's no, like, especially for women, there can be moisture and stuff down there. You want to make sure there's no yeast infections. So after I'm done with my urinary system, and if they have a catheter, again, I would assess that. I'd go all the way to I'd start at the patient, make sure that there's no drainage crusting, make sure my seal is intact, that it's attached well to my leg, and then it goes down to their Foley bag, and then I would look at their urine, make sure there's no problems there. Then I'm going to go to their legs. And here on the legs, I'm going to start like I talked to you about with the peripheral neurovascular and cardiovascular, that I'm going to feel down their legs for edema. I'm also feeling for color. I'm looking for any issues with skin integrity. I'm looking for any differences between the two legs. This patient has an ulcer on their leg, so I'm just noting that. And I'm looking for any sort of problems that are very overt. I might test for pitting if it's appropriate. Then I'm going to get down to their feet. And like I did before with the cardiovascular, I'm going to feel for their dorsalis pedis pulse on top of their feet. And after I locate and feel that, I'm going to feel for their posterior tibial, which remember, it's on the inside of their ankle, not on the outside. And then I would check my toes for capillary refill. Then I would also do my muscle strength test, which if you remember is where I come down here and have them push against my hands, and then also pull up, against my hands as well to see their muscle strength. And may have them do some range of motion, like wiggle their toes, rotate their ankles, and if they're able to, bend their knee up a little bit just to see what their range of motion is. No basic assessment is complete without looking at the patient's back. So get someone to help you, or if the patient's able to turn, look at their back, and especially look at their buttocks, their coccyx area, and look for any breakdown. Remember, like I said, a lot of stuff gets stuck in the bed. Always be looking for maybe devices or other things that might be putting pressure on the patient to avoid those device-related injuries. You should look at every inch of your patient in a basic assessment, but it doesn't take that long. I know it seems like it would take a lot, but you can do it real quick. A lot of it is just an inspection of what you're looking for. But that is a basic assessment head to toe, and kind of what I'm expecting for my students on a day-to-day basis, just to go in, do real quick of each body system to see what's going on, see about that basic function. That should give you enough information to get started for your day so that you can provide very safe and effective care for your patients. Hope this helped. See you next time.